Hi, my name's Nick. I'm one of the former global health officers for AMSA and currently working as the head of project of the 2015 Lancet Commission on Health and Climate Change. So I'm here to run through exactly what it is that this commission has been looking at and working on over the last 2 years in terms of the scope and who we are, but also talk about some of the key messages that come from the work. So we're a follow-up to a previous commission in 2009, which really rang the alarm bells in a way that hadn't been done before in climate change, running with the headline message that climate change is the biggest global health threat of the 21st century. Our commission started when a few of the authors from 2009 started talking and realized that many of the health impacts that they were most concerned about back then had already started to happen. And so what was needed now was, yes, to look at some of those impacts and reassess and reevaluate the epidemiology of climate change, but also go one or two steps further and talk about some of the policy responses, and importantly, the policy responses in a way that considers their potential impact on public health, both positive and negative. So we've been working for the last 2 years, and we're a partnership of a whole range of academic institutions all around the world, with most of us either in Europe or in China. I work at the University College London at the Institute for Global Health there, but we have experts from a number of different countries. And I think importantly, whilst there are a number of health professionals on the commission, we're a really multidisciplinary team. There are economists and financiers, there are political scientists, there are climate scientists and geographers, social scientists, development experts, and engineers and energy experts, all working together to design and deliver an integrated response to climate change in a way that protects and promotes public health. So the scope of the report is relatively ambitious. We break ourselves up into 5 chapters. The first chapter reanalyzes a lot of the climate science. It looks at how the health impacts have changed from 2009 to 2015, and finds that it may well be that a number of the health impacts have been underestimated. In looking at some of the direct impacts and overlaying the climatic changes with anticipated demographic changes, what we find is that populations are migrating and they're aging into areas of greatest climatic change. And so the exposure to events like extreme heat or extreme precipitation and potentially flood are much higher than had previously been realized. The second chapter takes each of these health impacts and looks at adaptation and community resilience policy responses that can be put in place to help minimize the health impact of those events. But drawing on and recognizing some of the useful messaging that the Intergovernmental Panel on Climate Change provided, there are limits to those adaptation measures. There are things that there are changes that climate change will bring that will simply be too great for us to respond to. And so with that in mind, the third chapter looks at mitigation, and it looks at mitigation particularly from an energy perspective, analyzing the burden of disease that comes from the current global energy mix, and then looking at a number of possible other scenarios in the future, particularly drawing on some of the health co-benefits, which are things that are both good for climate change but also good for public health. The fourth chapter looks at the economics and the financing questions around some of these new transitions. And the fifth chapter looks at the political mechanisms at a number of different levels. It looks at the UN Framework Convention on Climate Change, regional politics, national level policy, city level governance, and then all the way down to the individuals in terms of the importance of public opinion and behavioral change, and how these different levels might interact with one another. So in terms of what the Commission says, as I mentioned, the 2009 report led with the headline that climate change is the biggest global health threat of the 21st century. And in 2015, we don't back down from that statement. In fact, we confirm it and go further, saying that the risks are unacceptably high for public health and that they're potentially catastrophic. And from the perspective of the authors and from the Commission, I really don't think we could have been any blunter or any clearer in terms of just how concerned each of the authors and each of the commissioners are about these risks. And that's the first message, but the corollary to this is important. It's that it doesn't have to be this way. And that, in fact, responding to climate change could be one of the biggest global health opportunities of the 21st century. And there are a number of different ways where this comes to be. In part, it's by avoiding some of these health impacts. It's by reversing some of the economic loss that's going to be experienced, particularly by low and middle income countries. But it's also by looking at all of the different things that we'd like to do in responding to climate change and recognizing that if the policies are designed and implemented in a way that properly considers public health, they have the potential to yield ancillary benefits, benefits both for climate change and for public health. And so the classic example, or a classic example of this, is that if we look at coal-fired power plants and a transition from coal energy to cleaner renewable energies, not only do we reduce carbon emissions from that transition, but we also reduce rates and emissions of cardiovascular and respiratory health because of the reduction in local air pollutants. And these benefits come immediately, as opposed to the benefits in climate change, which are slightly delayed. So that's the Commission's second message. To help realise this, we come up with a number of key policy recommendations. The first, and perhaps one of the more important ones, is a discussion about what we should do with the 2,200 coal-fired power plants currently in the development pipeline. It's suggested that a rapid phase-out of these 2,200 coal-fired power plants is needed in order to protect cardiovascular and respiratory health. There may be a cautious role in a transitional sense for gas or for other technologies. But this recommendation comes bearing in mind both an interest in improving health by reducing climate change and improving public health directly by reducing the air pollutants that come from our current global energy mix. The Commission goes on to talk about the need for an unprecedented investment in climate change and public health research, monitoring and surveillance, so that we have the information that we need at a national level where it's relevant. The need to scale up financing for climate resilient health systems, making sure that in the event of an extreme weather event, potentially driven by climate change, a health system isn't the most vulnerable part of the government's infrastructure, but instead can act as an anchor for community resilience and really be one of the last structures standing. The Commission recommends a drive in a transition to low-carbon cities, talking about a whole range of different public health and climate change interventions that we might want to put in place in order to realize this transition. And the third key message is that all of this is possible. Is that achieving a decarbonized economy and the public health benefits that result from this decarbonized economy is no longer a technological, or an economic question, but in fact it's now entirely a political question. Whether or not we respond to climate change in a way that protects public health is a matter of needing bold political commitment. And this is important because it really sort of clears the air, I think. It simplifies matters and says the technology is readily available and just needs to be deployed in a sensible way and really tried out. The economics is well enough understood. There is plenty of finance available. Unfortunately, at the moment, the finance is just placed in the wrong place. What's needed to shift all of this is political will and political commitment, and it wouldn't take much to help drive that transition. At an international level, one of the best things that could be done to protect public health from climate change is implementing a framework for a strong, predictable and international carbon pricing mechanism. And the Commission talks about this and the potential impacts on public health. A second recommendation around the need for a decarbonised economy talks a lot about the importance of access to energy, particularly access to energy for many low and middle income countries. And this is important because there are two large convergences, that I think we're expecting over the next 20 years or so. The first, as was highlighted by the Lancet's Commission on Global Health in 2035, is a grand convergence in global health and in public health. The second convergence that we're expecting is one in energy access. And there will be a rapid increase, or we're expecting a rapid increase in access to energy over the next 15 to 20 years. But there's a crucial link there in that in order for the first convergence to be a long-term and sustainable convergence, in order for the growth in global health and improvements in global health equity to be long-term, the convergence in energy must be a low-carbon one. It must be one that prioritizes renewable and clean technologies that protect public health, rather than one that has previously been driven primarily by fossil fuels. And that's a really important shift in the way that we think about development. Another recommendation from the Commission is that as a supporting feature of much of this, we need to get much better at quantifying some of these health co-benefits. If we know that there are benefits that come from shifting a coal-fired power plant to a cleaner source of renewable energy, we need to get better at quantifying those co-benefits, and we need to get better at quantifying the cost savings. And this means not just I suppose, building up the political will for it, but it also means building up the capacity so that local health researchers have the ability to engage in these sorts of quantifications, and supporting that with legislation, and supporting that with local political support, so that when the legislation is in place, it's actually enforced. The fourth key message from the Commission is that the health profession has a vital role to play in responding to climate change and driving this transition, whether that's in communicating some of the risks or engaging with local or national policymakers to make sure that when we do respond to climate change, we do it in a way that protects and promotes public health. To this end, with the launch of the Commission in June, we're also launching a countdown to 2030, which is going to draw on all of the expertise that the Commission has amassed over the last 2 years and the collaborations, and build on that as well, looking to track and monitor progress in responding to climate change. But importantly, not just responding to climate change, also looking specifically at how we're going in terms of implementing some of the health co-benefits and the health resilience and health adaptation policy measures that are needed in order to protect and promote public health whilst responding to climate change. So those are the four key messages and a number of the policy recommendations that arise from the Commission's work over the last few years. There's obviously a lot more information available in the final version published in The Lancet, but to summarize, and really at the heart of the Commission, is an understanding that climate change poses a potentially catastrophic and unacceptably high risk for public health, but that responding to climate change could be the biggest global health opportunity of the 21st century. So we have this threat to opportunity matrix, and crucially, moving from a threat to an opportunity in terms of decarbonizing an economy or the global economy is no longer a technical or economic or technological question. In fact, it's now a political question. And that really clears the air a little bit. And then finally, in order to drive that political transition and encourage and support bolder political commitment, we need the health profession to engage in climate change in a way that it so far hasn't done. We need the health profession to engage in order to help drive a transition to a healthier future. Thank you.